Well, it's really very stiff competition for all of us in the healthcare industry, especially with the passing of the cheaper medicines law.
Right.
That brought about a lot of opportunities for manufacturing facilities, for importers, and as well as for distributors.
Right. How's your family life?
Well, doing okay.
Doing okay. You have kids, right?
Well, I have two kids, mature kids.
Whose genes?
What do you mean?
Whose genes? Mother or father?
Well, both.
Is your wife watching right now?
Well, I don't know, but she's in the province attending to the local business there.
The local business.
Yeah.
Interesting. Okay. I would like to understand really where you're coming from. You took what course when you were in college?
Well, I took AB Economics.
AB Economics. It
Yes.
has something to do with what you're doing right now.
Well, well, a little bit, because I started BS Biology, and I wanted to be a doctor at first, but later on I felt that, you know, I have to move on to a business course so that I can fulfill some of my visions of what I want to be.
All right. What made you realize that it's not for you?
Well, for one, at that time I thought things were just difficult to make it happen, because taking medicine is a lot of time.
Mm-hmm.
It's practically 10 years.
10 years.
So
You don't see
I usually thought about it. Doing the shortcut probably would be a good thing to do at that time.
Right.
When I thought that time was really a big thing. You know?
You coming from a business family?
Well, not really. My dad was a lawyer, but he went into land development. So, well, a little bit of business and a little bit of just managing some small business in the province.
What happened after college?
Well, I got employed with the biggest distribution company in the Philippines, which is LSK Europharma. And I moved on to many multinational companies, French multinational companies, American multinational companies,
Don't tell me you're
German.
also a United Caller.
Oh, very much. I worked with a lot of companies. So I have so many learnings in terms of cultures when it comes to business of many nationalities.
Which is your most favorite?
Well, I think the best is European. Well, not because it's more, they provide you a more liberal way of managing the business, but at the same time you feel the freedom when you manage the business.
Right. Why in this industry?
Well, I've been working for the past almost 25 years in this industry, healthcare industry, from distribution to sales and marketing, product management. So I've worked also with one of the biggest distribution companies in Asia, which is Telecom Philippines at that time. So I practically have all the experience in terms of pharmaceutical distribution, healthcare distribution in all aspects.
What's your most memorable selling experience?
Well, so many. For that span of years, experience is a lot, you know, a lot of experience.
One thing that you cannot really forget?
Well, rejection is one of the most difficult to forget in terms of selling. Because
bring it back to that time when you were rejected.
Well, of course, when I was very young then, when I started, well, at an early age of 21 in
At
selling.
21, you were selling.
Yes, exactly. So rejection at the time was difficult to accept. So you really have to be tough and strong to accept many rejections that come to your way so many times, you know. So, well, I cannot pinpoint one specific rejection because there were so many. You know,
all right.
so
The funniest.
Well, funniest.
I'm just changing my question. I'm just changing my question.
Yeah, funniest. Well, I cannot think about it at this point in time. Well, if I have to, if you put the.
When you get back to the show, tell us more about the
definitely. I have to think about it because I don't want to answer like a major thing, you know.
but yeah, but anyway, now that you are working with a European partner,
Mm-hmm.
and the Philippines is still a market. It's a market to beat. I mean, anywhere else in the world, the Philippines is the best place to do business.
Yes, the Philippines is still one of the most potential for starting a pharmaceutical business. In terms of manufacturing, in terms of distribution, and in terms of just simply sales and marketing. Importing, you know, because when we have to import products from India or China this time, we really have to support it with good sales and marketing
Yeah,
structure.
all
You know?
Telecom is watching.
Yes, and in manufacturing, we are actually at a point in time that so many challenges are being faced because of regulatory, because of cost of labor, and the cost of support systems. You know?
And you are with LSK Europharma.
Yes.
LSK Generics Distribution Center.
Mhm.
Is this an easy business to set up?
Well, I think I have to tell you a story about why we set up LSK Generics Distribution Center, because we started the company with manufacturing. So when I left the company I was working with for the past 10 years, we thought of setting up a manufacturing facility to produce quality generic products for the Filipino people, because we believe that the Filipino people deserves a quality, affordable, generic products.
Right, and this is the answer to that.
That's not yet, because we have to set up a manufacturing company. But the next problem is, how do we distribute these products to everybody in the Philippines? So the best solution to distribution is really franchising out distribution. So we came up with LSK Generics Distribution Center. We are selling franchise of LSK Generics Distribution Center.
So they have their own centers in the countryside?
Yes, they will buy franchise from us, and we will support them all the way.
So this is like encouraging people to start their own business out of what you already have?
Oh yes, oh yes, oh yes. It's exactly, we're looking for entrepreneurs who are willing to grow the business with us in distribution. This is not retail. This is not the usual drugstores that you are seeing all around us. But it is now, we are filling the gap, because the gap is actually in distribution. It's not in retail, because the retail is almost filled up with so many small drugstores all around us. But the real problem is how to farm out these quality, affordable pharmaceutical products to the farthest part of this country.
Right, exactly. So by far, how many centers do you have now?
We have so many applicants, but we have approved only 18 so far.
Oh, so it's not easy to apply for franchise?
Well, it's easy to apply, but
can
to
I
be
apply?
Oh, definitely, you can.
Okay, good.
Yeah.
How many centers do you have now?
We have operating centers. We have already 6 centers. We have 2 in Makati. We have 1 in Santa Rosa, Laguna, 1 in Bicol, 1 in Taytay, and Batangas.
All right. Why these places?
Well, they were the first ones to start operations.
Yeah, I thought the market was...
Because the real challenge there is how to secure the necessary permits and licenses, because the FDA now is quite strict in just approving all these stores all around.